This segment is brought to you by Trinidad and Tobago IVF and Fertility Center. World-class specialists, capabilities and care. Fertility step by step. Your journey to parenthood.
And welcome back. And thanks for staying with us in the second hour of Morning Edition. We're here today with Dr. Catherine Minto-Bain, Medical Director and Fertility Doctor, TT IVF and Fertility Center, which is based right here in Trinidad and Tobago and offers a full range of world-class fertility solutions for couples having trouble conceiving a baby. Dr. Catherine, good morning.
Good morning, Marlon. Thank you for having me here.
Yes, well, let's talk IVF this morning. Dr. Catherine, you are the expert. Just take us through the process, because I know there are some misconceptions. Huh?
Yes, so Marlon, there's a lot of misleading information out there about IVF. And, you know, IVF, we all maybe have heard of it. It's the most sophisticated and statistically successful of all the fertility treatments that are available. And it's really, truly, it's a wonderful example of what science and a good fertility team can achieve. But, you know, I think it's really it's really important that we're honest about the limitations of IVF. And that's what I really want to tackle today, this myth that IVF will always work to get you a baby. It's really surprising how many patients think, well, IVF's going to work for me so long as I go to the right clinic. And, you know, I do urge people to consider where you do fertility treatment. The very first thing you need to look for in any medical treatment is good accreditation. That will show you're being treated by qualified doctors and nurses and embryologists. And our clinic, for example, is accredited by TMOS out of Europe, which has some of the strictest regulations. Now, most people go straight to success rates, and when you compare success rates for different clinics, you see a wide range of numbers. In fact, you know, Marlon, interpreting these success rates is a topic we actually need for a whole show. But I'll tell you a secret. Research shows that success rates are actually startlingly similar between clinics and countries. And that's because IVF technology and the treatments, they're all largely the same, whether you're in Bombay or New York or right here in Trinidad and Tobago. There's no secret technology or secret treatment protocol that one clinic has and another doesn't. And when you're thinking about success rates, you know, actually I was just listening to a podcast in America, and the patient was asking, why is it that the government site, the CDC, says success rates of having a baby when you go to an IVF unit of 34%, and my clinic is giving me 80%. And you can really manipulate success rates. It's a bit like a running race. Let's say we're looking at 10 men and they're all about to start the men's 100-meter final. What's the chance of one of them being the winner? Well, it's clearly 1 in 10, 10%. But you can change it. Why don't you take out everyone who's over 25 and not really tell people you're doing that? Okay, that might leave you, I don't know, 7 people. And now you've got a much lower success rate. And if you take out the people that didn't make it to the halfway mark at 5 seconds, only 3 people made it there, well, now it's 30%. So you can see how you can manipulate success rates.
Yeah. So, Dr. Catherine, given those success rates, it's very clear that IVF may be a great treatment, but it won't work for everyone.
Yeah, and that's because every case is completely different. And I think maybe we can discuss just 2 key reasons in the time we have today. You know, that old saying that it's never too late. Well, yeah, true for romance and love, sure. But, you know, Marlon, it's not true for IVF. It certainly can be too late for IVF. And age really matters for the man as much as for the woman, for the sperms and the eggs. Because quality of these eggs and sperm, it worsens for everyone with age. Let's start with women. I think we all maybe have an inkling about women and their eggs and age. And there's something now that's very well known in fertility circles called age shock. And we see it in the clinic all the time. And this age shock happens when a woman gets the information that her fertility has really declined a lot because of her age. And I think a lot of women have a general idea that as you get older, you're going to have a harder time getting pregnant. But they truly don't know that the decline in fertility for most women is starting at around the age of 32. And, by the time you're in your 40s, most women are naturally infertile. And a woman's age, it affects two things: a woman's age, the number of eggs she has, and actually, more importantly, the quality of those eggs. So it's a double whammy. When you're older, you have less eggs to make a baby, and those eggs are going to be a lot less able to make a baby. And the truth is, IVF is not a cure-all treatment for infertility. If you're not getting pregnant because you have a problem with your eggs, the IVF lab and our IVF treatments, it can't change that. You still have a problem with your eggs. And IVF success rates drop sharply once you hit your 40s.
But Dr. Catherine, we're still seeing many celebrities in their 40s having babies.
Yeah, and the secret there, Marlon, the secret is donor eggs. And it's so frustrating. I get very frustrated. They don't say it, but most of those celebrities are having their babies not using their own eggs, but those babies come from a young, healthy egg donor that they've used.
So you're also saying that we men have a biological clock too?
Yeah, Marlon, did you know that?
I didn't know.
So, it's absolutely true. Women get blamed, but age-related fertility has been shown 100% now to actually happen to men too. Now, yes, we do see men who keep on making babies into their 80s and 90s, but, that's actually really rare. And as a man ages, his sperm quality, it drops, and he can run out of sperm like a woman can run out of eggs with the menopause. So, when you have a guy who has a very severely low sperm count now, then that guy in 5 years, he's really at high risk of having no sperm. So yes, older men have more trouble having babies. And, we see this in the clinic a lot. I'm thinking this week, 65-year-old man with his 27-year-old girlfriend. He's in the clinic, they're in the clinic. He's more likely to have low quality sperm, and this guy did. When you do the sperm quality testing, like the DNA fragmentation sperm test, he's more likely to have poorly swimming, poorly shaped sperm. So sure, she can probably have a baby with him, but she's more likely to have miscarriage because of his sperm. She's more likely to lose babies. The baby is more at risk of developmental problems like autism and other issues. But the good news here is that for couples like this with these sperm issues, IVF is certainly an option. And actually, that's what that couple are choosing.
Yeah, and Dr. Catherine, I suspect that's the takeaway here.
It is, yes. And I think people have to understand, if you're struggling to conceive, that's a really common thing. And you should investigate all your options, including IVF as an option, sooner rather than later. IVF should not be your last choice. Don't be one of the ones that comes to the clinic and says, gosh, we should have been here 5 years ago. I wish we'd done this earlier. People do run out of time. And the sad thing is, far too many women come to the clinic believing that we hold the secret here to them having a natural pregnancy with their own eggs when they're over 45. And these are the candidates these are the women that get these awful age shock. And, far too often I see patients, and the other doctors here in the clinic, we all see patients who've spent years trying hopelessly ineffective treatments like vitamins and hormones for male sperm issues, and egg growing tablets like clomiphene or fertility tablets for women when egg ovulation wasn't their problem. And the terrible thing about this is that if you're doing the wrong treatment, you're simply losing your good eggs as you waste precious time and precious money as well. And then you end up doing IVF at a later age when the success rates are lower. So, when you're worried about fertility or want a baby, let's try and do in Trinidad what, other countries do naturally. If it's not happening, you see a fertility doctor first thing. That's exactly what you do. Otherwise, you have a serious risk of being one of those patients where it's really simply too late.
So I think, Dr. Catherine, the message here is that if you're struggling with infertility, don't wait until it's too late. Think about IVF now.
Absolutely. And, since we're getting all the facts out there about IVF, I'll tell you another secret that you don't always hear about. IVF is not a cure-all for every fertility problem. So IVF was originally designed to bypass blocked tubes, and it works really, really well for that. So if the woman's tubes are the only problem you're dealing with and you have great sperm and she has great eggs, then all you need is IVF. And then in the 1990s, IVF got improved with the introduction of ICSI. That's when you take a sperm and you inject it into the egg to get that egg and sperm to merge and fertilization to happen. So if the sperm is of good genetic quality, and the problem is low numbers of sperm or just poor swimming sperm, meaning that those sperm can't get themselves to the egg naturally, then this sperm injection, ICSI, along with the IVF to get the eggs out of the woman's body, they're great solutions for infertility once the woman has good eggs. But sometimes IVF is not the best solution. So, for instance, when a man has low sperm quality and that sperm is not good at making babies, even if you inject that low quality sperm into the egg, oftentimes you don't get a baby. When else is IVF not the best option? For example, when the woman has a problem with her uterus, her womb lining, issues inside the womb that will stop an embryo from finding a healthy and a nice place to grow. That's not ideal for IVF. Sort out the problem inside the womb. Low egg quality. You try IVF, you try and grow lots of eggs, but a lot of those couples take 1, 2, 3 IVF cycles and they might not even be pregnant after 3 if the eggs really have big problems. And, we see lots of these problems in TNT. And, if the problem is with the womb, I'm not going to recommend IVF to a patient. On the other hand, the good news is that sometimes IVF is not the best solution because the simpler, less expensive treatments are going to help you have a baby. For example, insemination, IUIs, they can work really well when we identify the sperm has the quality issue, and we can actually work with the guy to get his sperm better quality. And then inseminations work extremely well if they're done in a lab where the sperm goes through filters. So if you're in a lab that doesn't know how to prepare sperm, or you're just putting neat semen into the vagina, that's the treatment that won't work. But if you're in a proper fertility clinic and you're filtering those sperms so only the good swimmers come through, you're really doing a great job there, and those couples get pregnant without IVF. That's a good solution.
Yeah. Dr. Catherine, we do have a very important image that I want to put up on the screen, and if you can explain it for us, please.
Yeah, absolutely. So tell me when it's showing and I'll tell you what I'm seeing.
It is showing.
Wonderful. So Marlon, this is one of the best parts of my job. This is an early pregnancy scan I did just a few weeks ago. So it's a pelvic ultrasound scan, and you're going to see lots of gray and black there. But if you see that pink arrow, there's a tiny, tiny little fetus growing in there. And that baby is about half the size of a grain of rice. And that's an IVF baby. And that's a tiny little fetus that's been in there a few weeks. It's a 6-week pregnancy, and you can see this little beating heart that shows us that not only did the embryo get in the right place, not only was it healthy, but it's got a placenta growing and feeding it, and it's now a lovely, live, healthy baby, and hopefully going to become a birth in the next 8.5 months, so that family has a baby. And it's so joyous, when we see this. You often have a patient crying while you're doing the scan. I mean, and the husband videoing away, and it's hard to almost believe it for some of these couples. This couple had been going through IVF and treatments for around 7 years before they got pregnant, been around the world. IVF wasn't their first line treatment. They'd had all sorts of problems and tried other things. But you know what? It's lovely to see, and it's an amazing time. It's one of my favorite times in the fertility clinic, seeing these incredible little babies.
Yeah. Dr. Catherine, what can men and women do to increase their chances of having a baby?
Good question. So, number one, come to a fertility clinic and get properly tested. The biggest problem in TNT is only half of the couple are tested. Only the man gets tested, or only the woman gets tested. So the first thing is do the proper tests and both get tested. If you want a baby, there are 2 of you going into it. Unless you're single and you want donor sperm, donor embryos, that's a different issue. Come to us and we'll talk to you. The second thing is look at your lifestyle. There's things you can do, make your lifestyle as healthy as you can. Don't smoke, don't eat terrible fast foods, put lots of those healthy fruits and vegetables into your body. That's the way to have a long, healthy life. That's the way to have good fertility. And number 3, let's say it again, don't leave IVF till the end. Don't think IVF is your last solution and you shouldn't come to the IVF clinic until you've tried everything else and you're kind of really desperate. Come early. We have all the treatments here and we'll get you the best ones straight away. Don't leave IVF until it's too late. So if you're struggling to have a baby, advice is talk to a fertility doctor as soon as you can.
Yeah. And is it that every case is going to be judged on its own merit, meaning that every case is different?
Yes, and that's why I love being a fertility doctor. I think we have 3 doctors here, and I've been doing this now for 18 years, and I'm still going to a webinar this afternoon because there's some new treatments coming out in Europe and they're talking about them. It's exciting. There's always new things. Every person we see coming through our doors is going to get evaluated for what is going on with them. This is not a conveyor belt. This is not a clinic that is just IVF only, like some of the clinics in the US where you come in and everyone does A, everyone does B, and everyone goes into IVF. Everyone is incredibly different, and there's all sorts of things that go into helping you get into a place where you can make a baby.
Dr. Catherine, as you know, because of your experience and expertise over the years, but you know that this could have, it could cause trauma for couples when they're trying to conceive, and there's a level of hopelessness sometimes. But is it that your facility also provides some level of counseling to get through the process?
That's the biggest part of fertility, and we have 2 full-time doctors and a 3rd one part-time, and we have 2 counselors in the clinic. That just shows you need an equal number of counselors and doctors. Often it's a huge part of it. The counseling isn't just psychologists helping people through with anxiety and depression and dealing with negative cycles, dealing with decisions. The counseling comes from all the staff. It comes from my admin staff looking after you on the phone, or seeing when you come in for your scan, you're having a low day, and helping you out. It comes from the incredible nurses that we have in our team that have been working here for years and support women through and give you that extra support when you need it, whether it's before your pregnancy or even after when you're pregnant, or when you're giving injections, or when you're despondent. And it also comes with doctors who understand your case, know you personally, and are going to put in that extra. There are times when I'll call a patient on an evening and just talk them through. I was talking with a couple last night that really want to give up their IVF cycle. They've just had enough. And you understand that. People sometimes feel like they've had enough, but sometimes if they keep going, they'll get just around the corner and it might happen. So yes, counseling support is a huge part of what we do.
Yeah. Dr. Catherine, if you could just sum it up for us, what's the last message you want to leave with couples who are trying to conceive?
Great. So yeah, let's sum it up. Number 1, IVF is not always the first line treatment. It really depends on your specific problems. Your fertility doctor has to be honest, absolutely honest with you, and find out what's right for you. Number 2, on the other hand, if you're struggling to have a baby, talk to a fertility doctor as soon as you can, because if IVF is the right solution for you, time matters. You don't want to wait until it's too late.
Yeah. Dr. Catherine, it's always a pleasure speaking with you. Speak to you again in the future. Thank you very much.
Thank you. Thank you, Marlon. Lovely to speak to you. Thank you.
Okay, so let's, we have an update for you from Scarborough. I don't want to say a traffic update. It's hey, we get some traffic this morning then. So we have a traffic update for you from Scarborough, Tobago. Yeah, and you can also take, I don't want to tell people to go there and take a dip, all right? But, all right, it's a good morning in Scarborough. Let's leave it at that. We're coming back.
This segment was brought to you by Trinidad and Tobago IVF and Fertility Center, world-class specialist capabilities and care.